Hello, my name is Diana Herrera. I'll be doing a head-to-toe assessment on a patient today.
Come in.
I'll close the door for privacy. Hi, how are you? My name is Diana Herrera. I'll be your nurse today.
Hello.
Can you give me your date of birth and name?
Yes, that's Jane Doe, 0101, 1988.
Perfect. Thank you so much. What brought you in today?
I've been having some lower back pain radiating to my pelvic area and some urgency and frequency when I go to the bathroom to pee.
Can you rate your pain?
Right now it's about a 3. I also have some fevers, but I took some Tylenol before coming here.
How long ago did you take the Tylenol?
About 20 minutes ago.
How many pills?
2 pills.
2 pills?
Yes.
Can you describe the pain that you're having?
It's aching, like punctures.
Does anything make it worse?
Yeah, when I walk, when I move.
Does anything make it better?
If I'm laying here in the bed, hurts less.
When was the last time you urinated?
Just did right now, and it burns when I pee, and sometimes it hurts a little bit too.
Do you have any dizziness and nausea?
No dizziness or nausea.
Do you have any history of kidney disease or kidney infections?
I had a kidney infection, but a while ago. Nothing major.
Alright. Do you have any allergies to any medication?
No known allergies.
Can you give me a little bit brief history, any surgeries, any history of any diseases?
Hypertension and hyperlipidemia, and the only surgeries that I had was a gallbladder removed and an appendix removed too.
Appendicectomy. Okay, perfect. Appendectomy. Do you have any sleep disturbances?
No.
No? Do you have any problems with any activity levels right now because of the pain or
No.
before that?
No.
Do you have any anxiety or worriness?
No.
Do you have any alcohol use or
No, I don't drink.
You don't drink? Any drugs use?
No.
Okay. Any suicidal thoughts?
No.
Okay, perfect. So I'm gonna be taking your vital signs right now. I'm gonna be doing your blood pressure. This is gonna be a cuff. There's gonna be a little tie on your arm.
Okay.
Let me make sure you're back there. Okay. And then I'm going to be taking your temperature, and also I'm going to be taking your, this is for the function of your lungs.
For
It's
the
gonna be a
oxygen?
pulse. Yes, that's going to tell me exactly how your lungs are working. And then this is going to be your temperature. Okay, your your oxygen is pretty well. It's 100. Your temperature is a little high. It's 100. So
it was 101.
okay,
before getting
perfect.
here.
That's good. And then your blood pressure is 130/95.
Okay.
And your pulse is 83.
Okay.
Okay? Now what I'm gonna be doing is I'm gonna be doing a head-to-toe assessment. I'm gonna be checking all your from the head to the bottom of your feet. I'm gonna start with your head. Is those glasses prescription?
Yes.
Yes. Do you have any hearing aids?
No, no hearing aids.
Do you have any trouble with seeing or hearing?
No, no,
No?
no.
Any
No,
ringing in your ears?
Mm,
No? Okay. So what I'm gonna be doing is I'm gonna be doing the head. Can I remove your glasses?
Yeah.
Oh,
No,
can you
that's
sit
it.
down?
Yeah.
Yes, please. Thank you. Are you comfortable there? No pain
No pain.
right now? Okay. So what I'm gonna be doing is I'm gonna be inspecting the skin. I'm gonna be inspecting all the skin on all the body as soon as I'm going over every single location. So I'm gonna be checking the skin of the head, the ears, eyes, neck, thorax, arms, legs, and then so forth and so forth. We're gonna start with the head. I'm gonna inspect all the structures. I'm gonna make sure that everything is good behind the head. I'm gonna make sure I'm gonna check his oral cavity. So open your say okay, so I check for his mouth, his teeth, his lips, his tongue, his tonsils, and the mucous membranes, making sure that everything is well. And then now I'm gonna check his ears. So I'm gonna check the structure itself, and then I'm gonna check inside that everything is good. Everything looks well. I'm gonna palpate and inspect the external ear. So I'm gonna make sure that there's no deformities or anything like that. Everything looks good. And now I'm gonna check his eye. So can you please remove your eyesight? Alright, so what I'm gonna do is I'm gonna tell him to look upward, look downward. And then I'm gonna check on the conjunctiva. Can you look up? Alright, it looks good. And now I'm gonna be checking on his pupils, so they're equal, they're round, I'm gonna check them with the light, and they're reactive to light. So I'm gonna come right here, sorry. Alright, they're reactive to light. And then I'm gonna check on his peripheral vision. So can you look right here, sir? What number do I have here?
2.
What number I have here?
2. 1, I'm sorry.
You gotta keep your
I'm
looking
sorry.
in front of me.
2. 2.
Alright, perfect. So his peripheral is working well. So now we're gonna go into the neck. I'm gonna palpate. You can put your glasses back on. Thank you so much. I'm gonna palpate the trachea. The trachea is good. The lymphos, they're not swollen. I'm gonna check and inspect the skin of the neck, making sure that it's symmetrical. And then I'm gonna get into the thorax. I'm gonna inspect the chest wall. So I'm gonna make sure that can I remove a little bit of the t-shirt?
Yeah. Do you want me to stand up?
Yes, please. I'm just gonna check. Are you okay?
Yep.
Alright, so we're gonna check his chest. Make sure that his chest is symmetrical, that his chest wall is good. I'm gonna evaluate his breathing. You could go back and sitting. Thank you. I'm gonna evaluate his breathing. So, since I didn't do it in the vital signs, I missed doing the respirations. So what I'm gonna be doing now is I'm gonna start counting his respirations while I'm inspecting his chest. I'm gonna check that it's symmetrical. I'm gonna see his rate, his pattern, and his chest expansion. It seems like he's breathing normally. So what I will do is I will take the time. So I'm gonna check the time, and then I'm gonna check for 1 minute, and then his respirations right now are 17, so he's good. Then after that, I'm gonna auscultate the lungs, and then I'm gonna check on his expansion, and then I'm gonna see if he has any problems. So I'm gonna tell him to breathe. Can you breathe for me deeply? ask you to do it on the back. So, and I'm gonna check every side and compare. Breathe breath. Big breath. Big breath. Big breath. Big breath. Big breath. Okay, so I checked that his whole lungs were working well. He doesn't have any irregular sounds or any crackles or any of that. So his lungs are perfectly pressed. Now I'm gonna be checking out his back. So I'm gonna go while I'm checking while I was doing the back respirations. What I'm gonna be doing is I'm gonna check for his spine. I'm gonna palpate the spine. Can you do some range of motion with your back?
Yeah.
Does that hurt?
No, no,
Will
no.
that hurt in your abdomen when you do that?
No, I extend no pain.
No pain? Okay, perfect. So now we're gonna move into the cardiovascular. I'm gonna be doing I'm gonna be checking your pulses. So on my vital sign again took the I took the pulse with the pulse oximeter and the BP blood pressure, but now I'm gonna be taking it with my fingers. So what I'm gonna do is I'm gonna be taking your pulse. Alright, his pulse is good. I'm gonna compare it to the other one. So I'm gonna compare both to see the pressure. Pretty good. Can you lay down? So I could check your pulses and your BP. They're pretty good. They're strong, +3. And then your heart rate is still 83.
Okay.
So now what we're gonna do is I'm gonna move into the cardiovascular. So now I already did but I'm gonna check the capillary reflex. So I'm gonna check them on the feet now that I have him laying down, and then and then I'm also gonna check it on the hands. Okay, perfect. Then I'm gonna be checking. I already checked his temperature, but I will check his temperature on the skin, making sure that like his feet and then his arms, where I took the pulses, they're good. Also, I'm gonna be checking on his heart now, and then I'm gonna be hearing on the heart, and then making sure that the skin and the integrity of the skin was good, and the color and the hair growth is also good. So as you can see, the hair grows good, hair grows good here. Now we're gonna move into the heart. So I'm gonna listen for the heart.
I'm gonna sit.
So yeah, can you please sit down? Thank you so much. And then I'm gonna twist the belt, and then I'm gonna listen for any murmurs. Alright, everything is good. So we're gonna move into the next part, which is musculoskeletal. What I'm gonna be doing now is I'm gonna be checking your extremities, making sure your strengths. And so can you give me your hands? Can you press my hands? Alright, good. Alright, can you put them up? Put them down? Any pain? No?
No pain.
Alright, and then what about your feet? Can you please lay down? Can you press against my perfect? Do you have any, can you put them up? Perfect. The other one? Perfect. Any pain?
No, no pain.
No pain? Okay, good. Do you have any pain in any of the muscles of your joints? No?
No.
Okay, perfect. So we're gonna work, now we're gonna get into the more focused assessment of the abdomen as he came in for kidney. So we wanna check a pain on the abdomen, and then there's sharp pain on the abdomen. So we're gonna make sure that we inspect the abdomen. We're gonna auscultate, palpate, and then make sure that everything on the abdomen is going well. Alright, so first what we're gonna do is I'm gonna inspect your abdomen. I'm gonna pull up your chair, your G chair.
Yeah.
I'm gonna make sure that everything looks good. It doesn't seem swollen, the skin looks good, there's nothing that is relevant. Now I'm gonna auscultate the abdomen on the quadrants. Alright, so I'm gonna start auscultating. And I'm gonna hear for his bowel movements. Bowel sounds, I'm sorry, no bowel movements, bowel sounds. Alright, when was the last time you went to the bathroom?
Today.
For number 2?
Yes.
Yeah, for species. And then urination?
Just a couple minutes ago before getting here.
How many times have you urinated in the last 24 hours, if you remember?
I'm just having frequency, so I go every 20 minutes.
Is it a small stream?
Yeah, small stream.
Okay. Does it hurt when does it burn or hurt when you pee?
It just burns.
It just burns? Okay. Alright, so now what I'm gonna do is I'm gonna be palpating. I'm gonna be asking him and checking if there is any pain while I palpate, as his pain is actually on the abdomen. So, any pain?
No, just discomfort, no pain.
Any pain?
No.
Any pain?
Mm.
Any pain?
No.
No? Okay. Now I'm gonna also I'm gonna percuss the abdomen to see if I hear any dullness, or if I hear any Alright, it sounds pretty good. So we will probably assess further with once the doctor comes in, and then to see what his pain is coming. Now I'm gonna be asking you, do you know who the president is?
Yes, Joe Biden.
So this is a neurological assessment. I'm gonna go into a little bit more of that now. So you said that the president was Joe Biden. Do you know what the date is?
Yes, Friday the 6th of October 2023.
That's correct. And then do you know where you are?
Yeah, in the hospital.
Okay, perfect. And then that's it, right?
Yep.
Yeah, sorry. Yeah. Now what I'm gonna be doing is I'm evaluating his speech, the way he responded to the questions, and then the questions that we had earlier. So that way I will know that he is oriented ×4. And now I'm gonna evaluate some new movements on sensation. So I'm gonna grab my light and I'm gonna ask you for no, stay there.
Okay.
Okay, so what I'm gonna be doing is I'm gonna ask you if you feel it or not. So I'm gonna check for sensation on his legs.
Yeah, I
You feel
feel
that? So do you feel that?
Mm-hmm.
Okay, and then I'm gonna check Babinski. At the same time, do you have any feeling?
Yes, I feel that.
Okay, and then I'm also gonna check the arms. Do you feel that?
Mm-hmm.
Okay, perfect. And the other one?
Yes.
Okay, perfect. So he has sensation in his arms. Now I'm gonna ask you to stand up, and we're gonna do some gait. What I'm gonna be checking is for you're gonna be closing your eyes and standing up your arms, and then please walk. All right, thank you so much. You can open up your eyes again, and then sit down. Thank you. And then now what I'm gonna be doing is, can you frown for me? Like,
Yeah.
can you puff your cheeks? Perfect. I'm gonna check if do you have any gag reflex? So I'm gonna check. Can you please swallow? Perfect. And then you could lay down again. In the test before, I checked for wrong reverse sign, which is when he stands up. And then that's pretty much it. Do you have any questions for me?
No questions.
No questions? Alright, so I'm gonna leave you your light call right here close to you. If you need anything, just let us know. I'm gonna go talk to the doctor. Do you have any questions about your about the plan of care that we have here on the hospital?
No
No?
questions.
Do you do you have any questions about the assessment that we just did?
No. Thank you.
Questions. And anything about your diagnosis?
No. So everything is good.
Okay, perfect. So I'm gonna leave the light call. You can call us anytime, and then I'll be checking on you, and then checking on orders to see, making sure that with the doctor to see if anything is needed, and then thank you so much.
Thank you.
All right. So this concludes my health assessment, head to toe assessment on a patient. Thank you so much for listening, and have a wonderful day.